Thank you, Mr. Speaker. Included in the A101 amendment is a new rate-setting structure for small crisis stabilization units. These are 4-bed facilities that provide short-term residential mental health services for Minnesotans experiencing a mental health crisis. This new rate-setting structure will help ensure the survival of our remaining small crisis stabilization units and will improve the access to mental health care, especially in Greater Minnesota. In addition, crisis stabilization units also save the state money. The alternative for most crisis stabilization patients is hospitalization, so sending them to a crisis stabilization bed saves the state money. I thank Chair Schultz for giving the original bill a hearing, and also thank Chair Liebling for including it in her author's amendment today. I also want to thank my fellow bill authors for their advocacy, Representatives Jessica Hansen, Representative Keeler, Franson, Eklund, Igo, Lislegard, Marquardt, and Sandstead. This provision is a great example of bipartisan problem solving. As I started working on this issue, I received a letter from a constituent named Laura. Laura's story begins as a stay-at-home mom who found herself facing severe treatment-resistant depression. She said in her letter to me, "As excruciating and painful as it was to leave my home and my family, I knew I needed a safe environment to go which could support my healing. The crisis stabilization unit was there in one of my desperate times. They provided a healing space. I was able to stay in my community and stay close to my family. Crisis stabilization provided me a safe and supportive environment which perpetuated my healing." Today, members, I'm happy to say that Laura is not only doing much better, but she actually went on to become a certified peer support specialist and currently works at the same crisis stabilization unit in Fergus Falls that treated her as a patient, helping others on their path to healing and recovery. I again thank Chair Schultz and Chair Liebling for including this in the omnibus today. We're going to have more stories like Laura's given this provision. Thank you, Mr. Speaker.